about bad names some of the medications that we're giving have gotten in the general public, and some of the misconceptions, and some of ways of not being helpful to the recovering person who you're close to and want to support, but you're hearing other things and you're feeling very uncomfortable, and in the final analysis you're not being supportive in the way that you need to be. So we talked about the idea that the Suboxone has a bad name and the Klonopin has a bad name, and your loved one shouldn't be taking these things because they're associated with bad people and bad things happening. Fact of the matter is, the strategy that we're using is a least harm strategy. You might say to someone, these drugs have the potential to be addicting and can therefore be harmful, and that's the negative aspect of it. But the positive aspect is they're less anxious, they're able to go to work, they're able to do things, they're able to handle their anger and their feelings of cravings much better, and other calamities that happen. Someone dies, someone breaks up with them, they're able to better handle life calamities without relapsing if they have the support of these medications. So the benefit outweighs the risks in our thinking. It's not always the case. We have to stand very close to the situation to make sure that this is what's happening. But that's the way we are moving. It's a least harm strategy. A lot of people feel like the less milligrams, the better. Now, you wouldn't say that to a diabetic who's taking insulin. The less units of insulin, the better, because they're closer to a baseline of no insulin, so their diabetes is not in our face now. But that's not the way you treat diabetes. You give the medication that you need because you have a standard which to measure it against, which is blood sugar. So if the blood sugar is in the right range, then the insulin is the right range. We don't have a standard to measure how much Suboxone, how much Klonopin to give a person. So that the bias now determines the show, and the bias right now is the less the better. So somebody coming into a therapist who has this philosophy is going to under-medicate this patient, and that's going to cause a possible relapse, the patient going on the street, patient dropping out of therapy, things that aren't going to be productive. So we have to find out what the right amount of medication is for the person coming in. Forget about the less is better approach. What we are trying to maximize is sense of well-being, self-esteem, and ability to function and handle life problems, and that's our standard for the use of these medications. Next tape coming up.